As we adapt to a new normal, the Rebound Indiana is working to make sure you know where to turn for mental health support.
And so our mission every day through the Rebound Indiana is to provide you the resources to get you through the pandemic.
And so today we look at Bowen Center, the largest community mental health center in the state, to see how mental health services are now adapting to this new normal.
It's so important for people to have a lifeline, especially when they're experiencing this pandemic-imposed isolation.
And Dr. Richard Rorold, chief psychologist for Bowen Center, says the ability to provide continuation of care for patients is critical. Thankfully, Bowen Center was already preparing to move into that virtual space, and they tell us they've been seeing successes over the past few months.
And our psychiatrists, they almost took no dip at all, and now they're seeing about 5% more patients.
Kurt Carlson is the president and CEO.
It sounds like this has been pretty successful for you guys, getting into the homes, helping people, not necessarily face-to-face, but virtually. What parts of this are you guys going to continue on or take with you as we go past the COVID-19?
Our psychiatrists and nurse practitioners are really finding this to be a valuable experience for them. If they have an opening in their schedule, they're taking people from all around the state.
Group therapy sessions have been more interactive. Outpatient show rates have increased since going virtual. Inpatient services like recovery center services have remained in person, but the telehealth option has provided more flexibility in care for other areas. And Dr. Rorold says the telehealth services has helped them to better serve some of their most vulnerable by removing barriers like transportation and mobility issues, geographical challenges, the fear of infection by COVID-19, and it also bypasses the barrier of stigma.
There are some people who simply, out of fear, out of shame, just won't consider walking into a counselor or mental health or addictions building.
And for Bowen Center, phone conversations have led to life-altering decisions.
We've been able to intervene and prevent at least a couple of suicides that I was aware of, specifically because we were able to walk somebody through a crisis on the phone.
And while there are challenges to treating patients virtually, the overwhelmingly positive response to this type of care could help telehealth services become a bigger part of our new normal.
How did they compare a telephonic or televideo service to a face-to-face experience? And then did they think it was beneficial? And 80 to 90% of people gave positive responses to both of those questions.
Now, as for the cost, 95% of the patients at Bowen Center have some sort of insurance coverage. But for the patients unable to cover their portion, the center does offer charity care to ensure that money is never a barrier to anyone receiving mental health care. If you're interested in learning more about the telephonic or in-person services through Bowen Center, you can find much more information. It's on our website, theindychannel.com/rebound.